Is Dupixent effective for treating COPD? Let's dive into the question of whether Dupixent, also known as dupilumab, is effective for treating chronic obstructive pulmonary disease, commonly referred to as COPD. Dupixent is primarily used for conditions like atopic dermatitis and asthma. It works by targeting proteins involved in inflammation, specifically interleukin-4 and interleukin-13, which are important in allergic diseases. COPD is a chronic inflammatory lung disease that leads to obstructed airflow from the lungs. It is often linked to smoking but can also be caused by other environmental factors. Traditional treatments for COPD typically include bronchodilators and corticosteroids, which help manage symptoms and prevent flare-ups. Now, regarding Dupixent's role in COPD, its mechanism involves blocking interleukin-4 and interleukin-13. These proteins are more commonly associated with allergic conditions, such as asthma, rather than COPD, which usually has a different inflammatory profile. However, some studies have shown that Dupixent may help reduce exacerbations in COPD patients who have elevated eosinophils, a type of white blood cell involved in inflammation. Despite these findings, it's important to note that Dupixent is not currently approved for treating COPD. Its use in this context is still being researched, and more studies are needed to fully understand its potential benefits and risks for COPD patients. For individuals with osteoporosis, it is worth mentioning that while Dupixent is not directly linked to osteoporosis treatment, managing chronic conditions like COPD can have an indirect impact on overall health, including bone health. In summary, while Dupixent shows promise in reducing exacerbations for certain patients with COPD, it is not an approved treatment for this condition at this time. If you are considering options for managing COPD, it is crucial to consult with healthcare professionals who can provide personalized advice based on your specific health needs.